Hey everyone! In the next few minutes, we're going to talk about something that could genuinely help you save a life. This isn't about turning you into a doctor overnight. Nope. This is about making you the most helpful person possible before the pros arrive on the scene. So, let's dive right in. So, picture it. There's an emergency. Someone's hurt. Everything feels chaotic. Your gut instinct is probably to just rush right in and help, right? But hold on. Is that actually the right move? What's the absolute number one thing you should do first?
And the answer? It's probably not what you're thinking. The golden rule of first aid, the absolute first step, is to make sure you are safe. I mean, think about it. You can't help anybody if you get hurt, too. Making sure the scene is safe isn't just a suggestion. It is the most critical first step.
And don't ever underestimate the difference you can make. When a bystander starts CPR right away, they can literally double or even triple a person's chance of surviving a cardiac arrest. You are that crucial bridge between the incident and the ambulance arriving. It's a huge deal. Okay, so you've checked the area, and it's safe. What's next? Your adrenaline is pumping, and it can be really tough to think straight. That's why having a simple, easy-to-remember plan is such a game changer. And here is that plan. Just remember this acronym, DRABC. Think of it as your mental checklist to cut through the chaos and know exactly what to do next. Let's break down what each of those letters means. All right, so D is for danger. We've already covered that one. R is for response. Are they conscious? You can give them a gentle tap on the shoulders and ask, are you okay? A is for airway. You need to make sure their airway is open so they can breathe. Tilting their head back slightly can really help. B is for breathing. You actually look, listen, and feel for signs of normal breathing for about 10 seconds. And finally, C is for circulation. Right now, that means doing a quick scan for any severe life-threatening bleeding. Now, this is so important. As you're going through these steps, or as soon as you realize something is seriously wrong, you need to call for help. Get someone else to call 911 if you can. The sooner that call is made, the sooner the paramedics are on their way. So now that we have that DARBC framework, let's zoom in on 3 essential skills that tackle some of the most immediate threats to a person's life. First up, severe bleeding. The number one most important thing you can do is apply direct pressure. Find a clean cloth, a t-shirt, whatever you've got, and press down firmly on the wound. If the injury is on an arm or leg, lifting it up above the level of the heart helps gravity slow things down. Now, you hear about tourniquets, but those are really a last resort for when the bleeding is catastrophic and can't be stopped any other way. Next, let's talk about choking. It's crucial to know that the technique changes based on the person's age and size. For adults and older children, you're going to use abdominal thrusts, what most of us know as the Heimlich maneuver. But for infants, it's totally different. You'll use a combination of 5 firm back blows, followed by 5 chest thrusts. And what if someone's heart has stopped? That's when CPR comes in. The magic number you're aiming for is between 100 and 120 chest compressions per minute. And here's a little trick to remember the rhythm. Just think of the beat to the song Staying Alive. No, seriously, it's in that perfect range. So you just push hard and fast in the center of the chest to that beat. Of course, not every emergency is going to involve CPR or major bleeding. Sometimes the most important thing you can do is just recognize the signs that something is wrong and get that person help, fast. So for stroke, we're going to use that FAST acronym we'll talk about in a second. If someone's having a seizure, your job isn't to hold them down. It's to protect them from hurting themselves. Clear the area around them and put something soft under their head. And for a severe allergic reaction, also known as anaphylaxis, you should help them use their epinephrine autoinjector if they have one. Let's look closer at that FAST acronym for a stroke, because it's such a powerful and easy tool. F is for face. Ask the person to smile. Does one side of their face droop down? A is for arms. Ask them to raise both arms. Does one arm drift downwards?
S is for speech. Is their speech slurred, or are they having trouble speaking at all? And T is for time. If you see any of these signs, it is time to call for help immediately.
Whew. Okay, we've covered a lot of ground, from assessing a scene all the way to some really specific life-saving skills. But look, watching this is just step one. The real goal is to turn this knowledge into action you can feel confident about. So let me ask you, do you feel a little more prepared to make a difference now? That's really the whole point here, to give you the confidence to step in, to replace that feeling of panic with a clear plan, especially when every single second counts. Now, to be truly ready, you need some hands-on training. I really encourage you to look for courses from organizations like the American Red Cross or the American Heart Association. That's where you build the muscle memory that just kicks in automatically in a real emergency. And hey, don't forget to get a refresher every couple of years because guidelines can and do change. I want to leave you with this final thought. In an emergency, it's totally natural to feel scared or unsure. But you have to remember that the greatest risk, so often, is just doing nothing at all. You now have a framework. You have the basic knowledge. You absolutely have the power to act.